The question we're asking is, does liposuction treat cellulite? We get asked this all the time, right? Everyone hates cellulite.
Everyone hates cellulite.
It's like a bad word.
And most of us have it. Doesn't matter how thin you are.
Yes.
It is just there.
Hi guys, hi Smita. This is Dr. Ashley Amalfi. I'm here with Lipstick and Lipo, your unfiltered guide to plastic surgery by 2 board-certified plastic surgeons, myself, Dr. Ashley Amalfi, and my good friend, Dr. Smita Ramanathan. And here we are with our Lipo series. We're so excited about this. I think we're maybe more excited than anyone else because we love liposuction.
We love liposuction. It's just the best.
We
love it so much. We named our show after it.
Yeah, it's our favorite.
Yeah.
And so we're so excited to talk about it. We've been talking about like some myths, answering some questions. Today, I think we're going to kind of tackle another myth. And the question we're asking is, does liposuction treat cellulite? We get asked this all the time, right? Everyone hates cellulite.
Everyone hates cellulite.
It's like a bad word.
And most of us have it. Doesn't matter how thin you are.
Yes.
It is just there. It's one of those things.
Yes.
But liposuction,
it's genetic.
It's genetics, it's certain areas, and so oftentimes you can be the thinnest person, have cellulite, and be bothered by it.
Yes.
So we'll answer that question.
I have patients who are fitness models. They're like prime muscle and body contour and composition, and they have cellulite, and it bothers them, right? Because it's not something that you can diet and exercise away.
Right.
But here's the kicker. Liposuction, unfortunately, is also not going to fix cellulite.
No.
I know.
So I feel just one of the, it's like stretch marks, there's like not much you can do to get rid of it.
No. Maybe like in 30, 40, 50 years, we're going to have like magic treatments for all these really hard things.
We're trying.
Yeah, there's stuff out there. Like there's definitely stuff out there that we can use. I mean, there's been injections in the past. There's Avali now, which I think is actually really cool, and we should definitely do an episode on that.
Yeah.
But the reality is that like liposuction alone is not going to treat that. And I don't know. I feel like maybe we should talk about what cellulite really is, because I think that's confusing for people, right? Do you want to talk about the bands and like...
Yeah. So, I mean, I think, right, so with our bodies, right, there's skin, there's fat, there's the fascia underneath, and oftentimes when you get cellulite, there's actually these fibrous attachments from the skin that sort of tether the skin down, which is why you get the puckering, right? And that's really the problem. And so those bands are pretty tight. And so with liposuction, you're not really sort of addressing that, right?
No.
Liposuction, there's ultrasound and all this stuff that can sort of help tighten those bands so that your skin gets tightened, but you're not getting rid of them. So you address the fat aspect, but you're still getting the puckering. And so that's sort of like the gist of cellulite, and then if you are a little bit older or you don't have great skin quality, then you have sort of the skin around that puckering, which adds to the cellulite looking worse. Yeah.
I mean, I would say sometimes, like, if you think about those bands and the fat on the sides of it is really big and bulbous, sometimes liposuction will kind of bring that difference in the contour down. So the cellulite is not like healed, but it might be a little softer looking, but we're not treating those bands. So the cellulite is not being treated. It's just that in combination with maybe making the contour a little better, it may or may not look a little less severe. But like Smita said, like if your skin quality is not great, it actually could make it worse. So these are, you want to talk, if it bothers you, you definitely need to talk to your doctor about it, because I think they can help you understand if it's loose skin or it's really cellulite, right? Because I think that's what people have trouble with.
Right. And it's confusing, right? I mean, that's why we're here. That's why you come see us, so we can talk to you about it, because like, how do you know that it's a loose skin? That's probably like the chicken or the egg, right? It's really hard. Or if it's a combination of both of those things happening. So,
which usually it is.
Which usually it's a combination. So, I mean, I think that's why it's important to talk to us, especially if you are worried about the cellulite or it's a concern of yours, because as you mentioned, there are things that we can incorporate into your treatment plan that better addresses the actual bands and the cellulite, while we are also doing the liposuction or whatever else we're doing to address other concerns. So that's sort of, and we'll be able to discuss that with you when we examine you and we see that. But if it's certainly something that concerns you, definitely bring it up.
Yeah, we definitely will do a topic on cellulite so you guys can talk. We could talk about some of the treatments that are out there and the approaches and what's being, happening in that space. Because I do think it's really exciting and there's new things coming and it's an area where we don't have great answers yet, and so I'm really excited about how that's evolving. A lot of new things in the last few years, so we'll definitely devote an episode to that. But here's our myth. I'm sorry to tell you.
It's like the worst news ever.
It is not going to fix your cellulite, right?
No, it's not going to fix it. Might make it better, but definitely won't fix it.
Yeah.
Yep.
All right, you guys.
All right, well, to end on a sad note.
We'll get back. Exciting things to come, we promise.
I know. All right,
guys. Stay tuned.
Stay tuned.
Subscribe,
Make sure you
and we'll see you at the next episode.
Bye.
Bye, guys.